is just a huge, unbelievable honor for me to be podcast interviewing Dr. Chris Chang, DDS, PhD of the Beethoven Orthodontic Center, Newton's A Inc. How are you doing?
Good, great.
And where are you at right now?
In Taiwan.
Taiwan. When I was lecturing, Ryan and I just went to Tokyo, Singapore, Malaysia, Indonesia, and South Africa. And you are a household name, not only in America, but over there, they just spoke so highly of you. I just want to give you, read your bio in case there's one dentist in the world who doesn't know who you are. Mm-hmm. You're an ABO certified orthodontist. You're a member of the Angle Society Midwest chapter. You're a publisher of the International Journal of Orthodontics and Implantology, founder of Newton's A and Beethoven Orthodontic Center in Taiwan, executive producer of podcast Encyclopedia in Orthodontics, author of Jobsology, co-author Orthodontics Vol I-IV, Clinical Implant Dentistry I and II. Dr. Chris Chang received his PhD in bone physiology and certificate in orthodontics from Indiana University in 1996 and is a diplomat of the American Board of Orthodontists. He is the author of Jobsology, co-author Orthodontics Vol I-IV, Clinical Implant Dentistry I and II, and publisher of International Journal of Orthodontics and Implantology. Dr. Chang frequently lectures worldwide on non-surgical orthodontic treatment, implant orthodontic combined treatment, and effective presentations. As a private instructor since 2006, he has taught over 2,500 doctors from more than 30 countries. In addition to teaching and publishing, he also founded Newton's A Inc. and Beethoven Orthodontic Group based in Taiwan. His passion in digital learning has led him to produce a series of video courses on orthodontics and implantology and app iOS, Beethoven Dental Encyclopedia, BDE. He has been actively involved in the design of orthodontic bone screws and application on impaction treatment. His latest focus is implant and orthodontic combined treatment. How are you doing today?
Great, thanks.
So it's 7 p.m. here. What time is it in Taiwan?
10 a.m.
10 a.m. So you have 3 presentations for us today, correct?
That's right. Mm-hmm.
That is, I can't wait to see. Do you want to? Well, first of all, what made you start getting so interested in mini screws?
Well, because in Taiwan, we have so many difficult and complex cases that I couldn't figure out how to fix it. When I get education in the United States, and later on I find this mini screw is very powerful to solve those complicated cases.
So is that because the United States is half European, 15% African American, and only 6% Asian, and now you were in a totally Chinese, Asian, Taiwanese population?
That's right. And also the orthodontic problem is if you don't fix in childhood, it will become more severe after they become adult. And that is the situation in Taiwan. That's why those cases are so complicated.
Well, you have combined orthodontics and implants and mini screws together like no one else ever thought it would happen. And you have a huge YouTube channel with more than 6,000 followers. You're huge into publishing 3D ebooks on Apple's iBookstore. Talk about that.
Well,
how do they find you on YouTube? It's youtube.com/what?
Well, you go to the YouTube and type Newton's A stand for Apple, 30301. That's my YouTube address, and I will show that in my presentation. Howard.
Okay, well let's start the. By the way, I gotta ask you, why did you pick Beethoven? Is it because he mastered the earliest form of a piano? What was that? Yeah. A harpsichord or
well,
what was...
There have 3 reasons why I picked Beethoven. Number 1, I am fascinated and obsessed with classic music, especially Beethoven's music. That's number 1. Number 2, Beethoven in Chinese actually is 3 characters. Bei is mean money. Do is a lot. Fun means share. So when you have a lot of money, you want to share with your friend, like Howard. I want to share my money with you. That's Beethoven. And number three, because Beethoven is the one we present that people are trying to do perfect job. That's why I pick Beethoven.
So when you lecture in Poland, do you call this the Chopin?
That's good. But I will try to have music of Chopin.
I think you should. I think if you should have an app in Polish and call it Chopin A Inc. because they are so proud of their Chopin when you go to Warsaw, Poland. So let's start your presentations.
Great. Mm-hmm.
Before I go, you're a big fan of Beethoven. You're also a big fan of Steve Jobs.
That's right. Mm-hmm.
And why is that?
Because I use Apple computer, and number two, because when I study his history, his story, I find out we have a lot of similarity. I love to simplify everything, and because you simplify everything, such as your treatment modality, that people can copy your treatment. Otherwise, if your treatment modality is so complicated, how can people learn your technique? And Steve Jobs did exactly like that in his iPhone, iPad, and computer.
He did. He was an amazing man. And did you read his book or see any of the 2 movies they made on his life?
I read his books several times, and I saw those movies. Yes.
He was an amazing man. But let's start with your presentations.
Great. Howard, I'm going to start with my background, which is where I practice. So if you look at this screen, that's Chopin for sure. So the screen, the video on the screen is my office Beethoven. So if you have a chance to visit Taiwan, you are more than welcome to visit my practice. And because everybody straightens their teeth a little bit differently, and sometimes it's quite interesting to look at how other people play the game. So before I get into my topic today, I think it's quite appropriate that I show you where I practice. I grew up in a small island by the name of Taiwan, which is surrounded by China, Korea, Japan, and the Philippines. If you look at from this perspective, Howard, you'll be surprised that my country, Taiwan, is right in the center of the world. Can you imagine? I'm from the center of the world. But later on, my friend told me, hey, Chris, you can rotate this globe that every country can become the center of the world. Nevertheless, if you Google it, the tallest building on earth, it used to be right here by the name of Taipei 101. Taipei is the capital of Taiwan, and 101 stands for 101 floor, measure 500 meters. It's a huge building. My office, Beethoven, is 14 miles south of Taipei 101. So find this building should be easy. Hit to the south, you'll be able to catch me. So let's start the question number 1. How would you fix a severe class 3 without surgery like this? We're talking about 11 millimeter discrepancy in the posterior area. In order to get into a good occlusion, we need to move the molar 11 millimeter. How can you do that? Most people will guess, well, in order to get 11 millimeter and minus 5 millimeter overjet, he was told that only surgery could solve his problem. 22 months. That's the result. Neither surgery nor extraction. Can you believe it?
Very nice.
Hey, Howard, that's 22 months. No surgery, no extraction. People said, it seems Photoshop. No, 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 it's a real case. Real case. The key is whole arch, move backward with BS screw. BS stands for buckle shape. Howard? Howard?
Yes.
BS stands for buckle shape, not ball shape. Okay?
Okay.
So, in fact, to correct this huge class 3, it only took me 4 months to convert negative overjet to positive overjet. Can you believe it? 4 months with mini screw. So let me use this diagram to show you how that works. First, you need to know where is the center of resistance for the lower arch. And with that, I put this mini screw and retract backward that create a moment. And this moment will rotate the occlusal plane and dislocate the whole dentition backward. So let me rotate and dislocate for you like this. Can you see that?
Yes.
And one more, and one more, and almost done. 22 months. Wow, that's huge. And used to be, Howard, this kind of case, people will put on the table to do orthodontic surgery. But today, with this mini screw, we can simplify the process and get non-surgical approach. I believe it is a minimally invasive approach. I am obsessed with this minimally invasive approach. When I show this approach to my grandfather, Charlie Burstone is the most famous orthodontic today. He is considered the father of biomechanics in orthodontic. And he looked at the way we fix this case. He punched the table and said, hey, Chris, I agree. This is a better way to treat this case. That's huge. But people who are skeptical will argue, hey, so what? It's not standard care because we don't see it in textbook. Don't worry. Howard, I published this case in this journal, International Journal of Orthodontic and Implantology. And the way I love to publish a case is I love to show people step by step, especially key step, because that's the only way that people can learn. If you only show pre-treatment, post-treatment, and somewhere in between, how can people learn? So every single step that I fix this case can be found in my journal. And it is free. And after that, every single case, I will evaluate the performance of this treatment. And I also put all my presentation in YouTube, and it's free. So you go to the Newton's A0301 and type amazing class 3. You'll be able to find this presentation. And you are not the only one, Howard. There are by far over 900,000 people watch this case report. How can you attract 900,000 people watch an orthodontic presentation? I have no idea. You check it out. So this is interesting. And people will still argue, hey, one case doesn't mean anything. I agree. So last year, actually just 5 months ago, we published 17 the similar case, and we put them together and take a step further, 17 similar case, and use finite element method to evaluate the force system that we use in this kind of treatment. And if you look through this case report, this study, you'll be able to find the first time a human being will be able to identify how we rotate the entire dentition. It's quite interesting. This is the first time, Howard, that we be able to know where is the center of resistance for the mandible, and where is the center of rotation that we can rotate the entire mandible backward, that sort of thing. First time in the history, and that's huge. And finally, you might ask, hey Chris, what's special for this approach? How? Let me use a diagram to show you. The school that I use is BS school versus most people will use MIA, which is a little bit smaller. My school is bigger, 2 by 12. Other people use 1.4 by 8. And what's the difference between the BS school and this MIA? Let me use this diagram, and my friend Dr. Ramsey will draw a beautiful diagram to show you the difference between my school and other people's school. The position is different. Let me blow that up for you. The school actually is outside the root. What other people like to put between the root, which is like this, between the root. And my school is outside the root. Because this school is outside the root, so we be able to move the whole dentition backward. But if you put a school between the root, then when you move backward, this screw will be in the way. So you cannot move the whole dentition backward. So this approach is huge to produce an entire arch digitalization. Furthermore, if you put screw like this way, horizontally, you might poke the soft tissue. That's why the failure rate is a little bit higher, and our failure rate is much lower. So with that, that reminds me the evolution of foam industry. How it used to be that people use rotary foam, but today, as a young generation like us, we never heard of rotary foam. We use iPhone. We don't use rotary foam. We use iPhone 6. Howard, have you ever heard about rotary foam?
Yes, I grew up on one and it was nailed to the wall.
Howard, we are young generation. We never heard about rotary foam, remember? We only use iPhone. Did you get that?
I got that. The phone I grew up on was fixed to the wall with 4 bone screws.
Okay, good. Good job. So if you are interested in this approach, we published in The Angle Orthodontic, November 2015. And the failure rate is just 7%, which is very, very small. And that's the end of my first section. Howard, you have any question?
Yeah, do you ever use these on the upper maxilla?
Oh, you are so smart. Good. But before I get into that, I would love to give you the background, my education background, so you know where I get the education. And then we continue to the lower first, and then we get to the upper. Let me give you my background, my education background. I was lucky 30 years ago. I learned orthodontics from Dr. Chang. And Dr. Chang is like the founding father of orthodontics in Taiwan. 5 years later, I went to United States. I learned from Eugene Robert in Indiana University. And Eugene Robert became my godfather and my mentor. And about 12 years ago, I have a chance to know Dr. Damon. So ever since I know Dr. Damon, I switched to the Damon braces. I enjoy these braces a lot. And with Dr. John Lin and Dr. Gene Robert, we later on designed this BS school. And with this BS school and Damon braces, and we can solve a lot of complicated cases. So with that, let me show you one more case. The case number 2. How do you fix a severe posterior buccal crossbite like this? Did you see the buccal crossbite?
Yes,
severe.
that is severe.
You couldn't see the lower dentition. Wow, that's huge. And that's 10 months later. 10 months ago, she was told by 4 doctors that only surgery could solve her problem. But I was wondering, what kind of surgery you want to do with this girl? Are you going to cut the bone right here and cut the bone down below? No, we don't want to do it. What we did is we just used one BS screw. And let me pull that up. From here, you have 7 millimeters from the screw to the molar tube. And 3 months later, the molar tube hit the screw. In other words, we move 6 millimeters outward for these 2 molars. That's how we saw this buccolingually collapsed molar. Wow. Is that wonderful? To avoid surgical approach. Final one. This is the oh my God case. I would love to challenge you, Howard, how to fix this case. It's amazing dilacerated impaction. Dilacerated means the root is 90-degree curve like this. And if you look at the common CT, you'll be able to see the situation is so complicated because above this dilacerated tooth, they have odontoma right here. So how would you fix this case, Howard?
I would have zero idea.
You cannot refer. You have to find a way by yourself. So it's 7 millimeters down below, and the root is dilacerated. And actually, the root is hooked in the nerve. Nerve is right here. So it's very dangerous. So do you know how oral surgeon wanted to do? They want to remove all and put 2 dental implants. And let me tell you, if you do that, you might run into a risk. You might break the entire mandible. You got that, Howard?
I agree. I agree. That would be a very bad idea.
Well, that is a bad idea. So what we did is we put this mini screw in the buccal shape, buccal BS screw, and use this 3D level arm like this. And we be able to bring this 17 millimeters down below to the occlusal within 25 months. And it is a minimally invasive. Is that cool, Howard?
That is very cool. That is unbelievable.
I was so fascinated with this approach. 17 millimeter dilacerated root can be fixed with this simple, elegant approach.
Now, does this change the position of the temporomandibular joint? Is there any implications on the joint?
The beauty is no, because the screw is just fixed there, so it's nothing to do with the TMJ. So that's the beauty of this approach.
Very nice.
And you might ask, well, this is a good approach. What is the failure rate for this screw? As I mentioned before, I did 1,680 buccal share screw for the past 3 years, and the failure rate is just 7%, which is very small. So, Howard, let me show you the last case for the lower before we get into the upper. What would be your plan for this case? Which one would you take out? You want to take out the third molar or second molar?
I would probably, that is a hard case.
Let me tell you, the nerve is right here. So if you take out the second molar, you might damage the nerve. If you take out the third molar, how can you move the second molar outward, upward? Because it's so deep and it's horizontal impact. Let me give you a story that about 4 years ago, a famous doctor from United States, his name is Arnie Rosen. He told me he's very famous. He is an associate dean from top university. He told me the story. He had a case like this. The oral surgeon prescribed take out the second molar, and when the surgeon take out the second molar and damage the nerve, so it ended up a catastrophe result. So taking out the second molar is not the option. It's the complication is huge. So we don't want to take out the second molar. Instead, we would love to take out the third molar. But the question is, how can you upright this deep horizontal impact second molar? How? Do you have any idea?
No.
What
But I
if?
bet you used a BS buckle shelf bone screw.
Pretty close. It's similar. You are genius, Howard. I can tell immediately. The way I did it is I put a screw right here. So with this screw, I can hook up a power chain. With this power chain, I'll be able to upright it. And let me show you how I did it. That's the first month. Did you see any change? Look at carefully.
Oh,
Did you
yes, yes.
No, you see nothing. We haven't started yet. And 2 months in the treatment, how? Did you see any change? Right here. Did you see the space between the second molar and the bone? Space. Did you see that?
Yes.
And 3 months. Did you see that? And 4 months. Wow. How could that possible? And you only hook out the power chain from this attachment to this screw. It's similar to buckle share screw right here. And now you can put the braces along with the long axis in 7 months. 7 months? How could that possible? Let me tell you, the most rewarding thing you do in life are often the ones that look like they can be done. And this is the example, Howard. Would you agree?
I would agree. That is an amazing case.
Wow.
That is an oh my God case.
Oh my God, okay. So let me conclude. It is indeed a revolutionary approach. Because the reason why people take out the second molar is because they have no idea how to upright this second molar. And now, with a simple screw, you'll be able to upright within 7 months. Is that great?
That is fantastic.
Thank you.
You should be very proud. This is a very amazing innovation.
Wow. Howard, that is why I'm so excited every day. Every day I want to get up and couldn't wait to work because there are so many things waiting for me to solve. And you might ask, what is the failure rate for this Raymond school? Because why is it? It's just 5%. Can you imagine? And let me give you the summary of the failure rates in various approach. You'll be able to see the huge benefit. When you have the screw that between the root, which is the old one, you get a 20% or 12%, 20% in the lower arch and 12% in the upper. But when you put outside the screw, like a buckle shear screw is only 7%, and this Raymond screw is only 5%. And this 5% is because the patient didn't brush well. If they can keep good oral hygiene, and I don't have to take it out when they get inflammation, and the failure rate would just 0. Can you believe it? 0%. Because all the screw is there. So if you are interested in this approach, you can find it in iJOI Vol I-IV, published January 1st this year. Every single detailed approach is right in this article. Can you believe it? Every step and all the material I publish in YouTube is free for you to download and free for you to watch. Is that great?
That is fantastic. What about the age range of these patients? Does there come a time when you're too old for your bone to respond to this?
Wow, Howard, you are genius to ask the right question. I think for this case is 26. I think if the age is like your age, I guess you are about 30, okay? It's still okay. For the 30, under 30, I think it's okay. Between 30 and 40 is questionable. Over 30, it might be too old. So you are okay. You are pretty okay, Howard. Congratulations.
Very good.
So I'm so excited to put this information in YouTube to share my friend.
Very, very nice.
So what is your question, my friend?
Do you use these on the upper maxilla?
Yeah, that is the next. How about the upper? If we can fix the lower, we have the way to fix the upper. So the most popular is the overjet. Overjet means upper jaw and lower jaw have a big difference, big distance, big gap. For example, 10 millimeter overjet, which is considered huge. In the textbook, they say if you have over 8 millimeter, that is considered surgery case. But this man, 25 years old, with 10 millimeter overjet, buccal crossbite like this, is a huge buccal crossbite. Can you see that?
Yes.
Both second molar is buccal crossbite. An adult patient, 10 millimeter overjet. Can you believe it? How can you fix it? 10 millimeter.
That is a lot.
That is a lot. And his humble request will be no surgery, no extraction. Can you fix it, Howard?
I could not.
You could not? You want to know how to fix it?
How?
That's the result. 26 months later, we solved the big overjet. We solved the class 2. We solved the buccal crossbite like this. Did you see the big difference?
That is an amazing difference.
And no surgery, no extraction. Wow, how could this be possible? The key is we put a screw on the top right here and move the upper dentition backward. That's why, and because the screw is outside the root, that's why we can move the whole dentition backward like this. Is that amazing? It's similar to the lower. Wow. So let me tell you, again, it is indeed a revolutionary approach to put a screw outside the root and you can move the whole dentition backward. And people will ask, hey, Chris, it's not going to stable. This is 3 years follow-up. Look at that overjet, holding pretty well. And look at that occlusion. So the conclusion is, it is stable. Even 3-year follow-up for this adult patient. So what is the second application for the upper? Howard, how would you fix this severe gummy smile?
Now that is a very common cosmetic problem that most Americans would treat that with surgery.
Oh, you are genius. I bet 100% people will think this is a surgery case. And when she come to my office looking for minimally invasive approach, I explain that this case is definitely surgery case. Would you agree?
I would agree.
So, what is your plan? You want to do surgery?
No.
If no surgery, how can you fix it?
With a BS buckle shelf bone screw.
You are so good. So I went ahead and explained how to fix this case. First, we take out 4 first premolar. So when we close this premolar space, we'll be able to solve the bimestral protrusion. That's step number 1. But you still cannot take away from the gummy smile. So the second step is to cut a piece of bone like this. After we cut this piece of bone, about 5 millimeter, we impact the maxilla and glue secure with this mini plate. So that's a 2 mini plate per side, so it's a 4 mini plate with surgery. The surgery will take about 4 hours. And after I explained this treatment modality, this lady told me, hey, Chris, this is the ideal solution, but that simply doesn't fit into my personality. I would love to have minimally invasive approach. Is there any other way? So I explained, maybe we can use screw. So when I explained how I use the screw. And guess what? After I explained the screw, Howard,
Yes.
do you know her response?
She loved the idea.
Yeah, her immediate response is this. School, please. School. You understand, Howard?
Yes, a BS.
So I went ahead and put this school on her right here. And that's the result. The only word that I can describe this result is WOW. It's the same girl. Can you believe it, Howard?
That is an amazing difference. That's
No,
a life-changing difference.
that's life-changing, definitely. So instead of one boyfriend, now she can enjoy many boyfriends.
And if you turn that wow upside down, it'd be mom, and I bet her mom was just as ecstatic as she was.
Oh, Howard, you are such a genius. So I need to turn that upside down?
Yeah, because then it'd be mom. The wow would be mom, and I bet her mom was just couldn't believe it either. I bet her mom was as excited as her daughter.
Howard, this is the inside story. After I fixed her, her mother come in my office. She wanted me to use the same approach to fix her. But her mom is about 60 years old. I said, can you give me a break? Do you understand?
Yeah, so you thought she was too old? Did you try it, or did you just say no, she was too old?
Because a little bit too old. I love to fix young lady. You understand?
Yes.
That's the major benefit, so they can have a good life. And to conclude this case, I think this approach is huge. Did you see that huge gummy smile? And we can end up with a beautiful and soft smile. Beautiful. I really love this approach. So what else? Third application. Howard.
Yes.
If the canine run into central and lateral like this, so you need to have our force system. Ma'am, how would you fix this case? The canine is between central and lateral, which is very difficult. So I use this mini screw with 3D lever arm. I'll be able to produce a backward, outward, downward force system, and I will be able to solve this problem like this. So let me ask you, Howard, my friend, is this really hard to fix?
Yes, it's incredibly difficult to fix.
Yeah, I bet you're right. It's very difficult. So between the root of the center incisor and lateral incisor, these two videos show you exactly where that impacted cuspid located. It's between the center and lateral root. With that, let me ask you again, my dear friend Howard, is this really hard to fix?
Yes.
You sure?
I have a feeling you fixed it with a bone screw.
Let me give you a quick review. 7 years ago, I spent $300 to buy a book. $300. Are you getting it? $300 is a lot of money. For poor doctor like me, $300 is very expensive. So what kind of book cost me $300? It is this book. So let me show you. The canine is right here. Let me pull that up for you. Make it bigger again. Did you see that?
Yes.
How? It's between the center and lateral roots. That's why I spent $300. I want to know how this expert fixed this case. So without open up this book, I paid $300. I was so excited. I get this book and run home and try to figure it out. So I turn to page 172, and the canine root is between center and lateral. The orthodontic resolution and alignment are often impossible. That is right. That's why I spent $300. So I turn to the next page. There are 3 options for that. Leave the canine in place. How can you do that? You already take the common CT. You cannot you cannot pretend you didn't see it. Number 2 is refer to the oral surgeon to take it out. No, we are orthodontic. We want to keep the canine. We want to have canine guidance. Number 3 is carefully planned directional orthodontic force, which I don't know what that means, but I assume it's carefully planned directional force system. So I was so excited. So I turned to the next page. And that's the end of the discussion. How? What would you do? You pay $300.
I would want to see a case. I'd want the discussion to show me how to do it.
But it's the end of the discussion. I run to the last page of the book. I couldn't see any discussion and didn't show any case to solve this problem. What would you do? $300 gone. Howard, are you sad to spend $300?
Yes.
But I was so lucky. The next month, I was lecturing in the United States along with this author. His name is Andrea Baker. So we lectured together. So I asked Dr. Baker, hey, Dr. Baker, I spent $300 by your book. I couldn't get the answer. Can you tell me the answer? But Dr. Baker keeps smiling. So I figured out, I believe this is an unsolved mystery, because if Dr. Baker cannot figure out how to solve, I bet very few people in the world know how to fix it. That's why you believe it's very difficult. Right, Howard?
Absolutely.
Absolutely. So let me ask you again, is this really hard to fix? The answer is or no. No. With our school and 3D labor arm, that's 5 months in treatment. Did you see the canine is in the place? It's ready to erupt right here. Just 5 months is minutes with this school and 3D labor arm is over there. Wow. And it's unsolved mystery, Howard, remember. So if you ask my grandfather, Charlie Burstone, is this difficult to do? His answer will be, with right mechanics, it is easy. So the top tip, hot tip, is school with 3D labor arm. You'll be able to change the direction and force this canine into the occlusion. It's so easy. So you select the right tool, you'll be able to fix this problem. Howard, that's the scoop for the upper and lower.
That is just simply amazing.
Thanks.
Simply amazing. You are as innovative as Steve Jobs. You are the Steve Jobs of ortho.
Thank you.
And
so,
yes, you are just carrying this message around the world in person. You're carrying it around the world on YouTube, and with ebooks. I mean, you're just sharing so much information. You're absolutely changing the face of orthodontics around the world.
Thank you. After I invented this approach that I get invited to give a lecture, for example, this year, I need to give a lecture over 22 countries. Can you believe it? I have to travel and I have a practice to see my patient. Besides, I need to travel 22 countries this year. That's why I come up with to put all my presentation in the YouTube. I have by far 369 presentation in YouTube. And I asked my friend, why not just watch my YouTube instead invite me to travel to your country? But the more I put in the YouTube, the more invitation I got. So that's why I needed to travel so many places.
Well, it's going to be a while before all the I mean, it sounds strange to think that there's a physician or dentist in the world today that's not on the internet, on social media, on YouTube and internet, but it's amazing how many I find every single day. And I lived in a house with five dentists through dental school, and
Mhm.
two of them, they're never on the internet to this day, and we're all the same age, 53,
Uh-huh.
and so it's so you're gonna have to mix bricks and mortar lecturing and books along with the internet. The internet digital is the future, but there's still a lot of doctors out there that just do not embrace internet
So,
learning.
so Howard, when I look at your internet stuff, I find we have a lot of similarity to get this good information spread all over the world. I'm so happy I have the chance to know you. So I was thinking about what would be the best way to spread those great ideas. And the first obvious is to give a lecture in various countries so people get to know you. And later on, I was thinking about that would be too much to travel. So I put all my presentation in the YouTube. So people won't be, do not need to invite me to give a lecture in their country. But later on, I find out it might be good that I write up those lecture case in and publish in a journal. And the journal I would love to publish is International Journal of Orthodontic and Implantology. It's iJOI. And also AJODO, which is the premier journal in our profession, American Journal. So Howard, I would love to update our publication 7 days ago, which is April 1st. That's AJODO. We published a case in AJODO. AJODO, as I mentioned, is the premier journal in the world. Would you want to look at this premier journal?
Yes.
So first, let me ask you, how would you fix adult skeletal class 3 like this? It's a skeletal class 3. It's supposed to be very difficult. The AMB angle is -3. -3 is mean very, very difficult to fix. And on top of that, how can you improve the profile like this? And he has a severe crowding. We measure about 11 millimeter space discrepancy. And how can you develop a space to accommodate this arch? And if you take the teeth out, how can you solve this retrocline low incisor? So in this case, you cannot take the teeth out. If you cannot take the teeth out, how can you create a space, 11 millimeter space? It is difficult. So people were thinking about for this difficult case, you need to take 4 bicuspid out and do orthodontic surgery. But unfortunately, the patient refused to have surgery. So his humble request was non-surgery, non-extraction. So how can you solve this case with non-surgical and non-surgery? And if you look at the cover page of this issue, they are using my picture as their cover page. And after that, the editor called me, hey, Chris, can you give 4-minute video presentation so they can put in their website so people can understand how I fix it? And imagine, this is a complicated case. How can you use 4 minutes to explain a complicated case like this? It has to do with you need to have effective teaching method to do that. Do you agree?
Absolutely.
So, Howard, I would love to show you this 4-minute video and watch carefully. Look at the statement that I make, which is coincide with the computer animation. Those are very difficult to make. So pay attention to that. You'll be able to enjoy this video. Ladies and gentlemen,
This is a Christian from Taiwan, along with my colleague, Linda, and my mentor, Jim Roberts. We would love to present a conservative treatment of skeletal class 3. How would you fix a case like this? In other words, how would you get from A to B? To be more precise, how would you increase A and B by 2 degrees? By doing this, we'll be able to bring the front teeth forward and push the molar backward. His humble requests were no surgery, no extraction. How can you fix this complex case without surgery, without extraction? And what will be your treatment plan? Our minimally invasive approaches are class 3 elastic, bi-turbo, open coil spring, and mini screw. There are 3 keys to this treatment. Key number 1 is the key to deal with severe crowding with non-extraction. And it is the key to select proper top. On the top, we use low top because severe crowding with non-extraction. Down below, we use standard top. The idea behind this is whenever you have crowding with non-extraction, you normally will end up flaring of the upper incisor. Low top bracket can compensate this side effect. On the other hand, non-crowding with extraction, you will end up with upright central incisor, high top bracket come into play. Other than that, we use standard top. Key number 2 is the key to unlock anterior crossbite. We use class 3 elastic in conjunction with bi-turbo. This anterior bi-turbo is so effective to open the bite and correct the anterior crossbite. Key number 3 is the key to create space and distalize the molars. We use IPR to reduce the tooth mass, and we also use open coil spring to gently open up the space. To distalize molar, we use mini screw. This mini screw is very effective to distalize the molar. It can also prevent anterior flaring. With these 3 keys, we'll be able to manage this difficult case into an acceptable result. Is that stable? 3 years follow-up. It is stable. Most importantly, this patient loved his new smile. He showed more teeth with full of confidence, even though 2 degrees sounds very small. The change in profile is huge. If you are interested in this case report, you can find it in iJOI 2016 edition. To conclude my case presentation, I love minimally invasive approaches. My patients love minimally invasive approaches. And who wouldn't? Thank you.
That was amazing.
Thanks.
And not only is your orthodontics and implant cases amazing, but your video presentation, your graphics, your presentation, I mean, it's like it comes from Hollywood or Bollywood. I mean, it's just an amazing presentation.
Thank you. So, presentation, publication, and finally is get everything together and put into iPad, a book. So when people look at the book, they can also look at the video, the presentation. Is that a great idea?
That is a great idea.
So we come up with 3D iBook. So I'm going to show you this 3D iBook. And do you know, when people tell me their product is revolutionary, I already immediately think about this guy tried to bullshit me. But let me tell you, this book is indeed revolutionary. I would love to show you. Do you want to see this 3D?
Absolutely.
Okay, let me show you this 3D ebook. When you open up this iPad and you find the bookshare, the iBook bookshare, and you open up the bookshare, you'll be able to find I have by far 10 3D ebook on the App Store, Apple Bookstore. So let me give you an example. The volume number 4 is right here. So I open that up. Wow. So you can go to the case report that I have right here, and I show you this case, or the first case. I show you a severe open bite, how we fix this open bite, like this. Look at the midline. We also correct the midline, correct the open bite. But this case is too easy. So let me just skip this case. This case. This is a good case. That's the case I show you. So you are in the iPad. In the iPad, you can mark, you can also search, you can also have a dictionary there. And look at that, you can blow up the picture. That's the case I show you. The class 2, big 10 millimeter overjet, supposed to have surgery, and we did it non-surgically. And imagine, is that possible that we can hold the model, the 3D model, and look at this model in every single aspect? But it's in the book. Can you imagine, Howard? Howard.
That is amazing.
In the book, you can hold the model, and after that, you can look at the treatment, and all the treatment procedure can be found in here. So that's after the treatment. Wow. The picture is so big, so you can study step by step. And that's the finished model that show you every single aspect of this treatment. And you might think about, do you have the step by step? Of course. If we are looking at the step by step, I will show you right here. Step by step. So when we put the braces, 6 months later, and 11 months, we put 15 months, we put a mini screw to describe the whole dentition backward. Every single step can be found in this book. Wow. And finally, I also put this barcode share screw. If people want to know how to put this barcode screw, you get it. I have a video to show you how to put a screw. And this is the regular paper that published, which is good. But the better way will be have interactive fashion, which if people are sitting in their living room, they want to know how to put the mini screw. They can learn how to put a mini. Let me show you. This is a video showing you how to put a mini screw. It's so clear. And how imagine you are sitting in your living room, watch the HBO, and at the same time, you can study how to put a mini screw. And if you are not comfortable, where is that barcode share? Then I will show you this dry scar, and every single aspect of the dry scar is right there. So before you put a mini screw, you look at the dry scar, you'll be able to know where you want to put your screw. So is that amazing?
That is beyond cool. Amazing.
Yeah, that is so cool to have a book which contains the test and also the video and the diagram. So let me conclude my interview today. I believe this approach, the mini screw, the publication, and finally this 3D ebook is indeed revolutionary. It's a revolutionary product. And if you want to know more about this, I also put my email right here. And at the end, I want to, from the bottom of my heart, I want to say thank you, Howard. It's such a great honor to have a chance to talk with you today. Thank you.
The honor was all mine.
Okay. Any question by far? Huh?
No, I just think what you've done is amazing. And if you ever want to, I mean, you're world renowned. You have 900,000 views on YouTube. If you ever want to push that over the million for sure, we have the Dental Town website and the Orthotown website. I think if you put this is a podcast, but I think if you did a presentation and put it on Orthotown, our Orthotown magazine goes to 10,500 American orthodontists, and half of them are on orthotown.com. If you did an online CE course on there, every one of them, if you put it in the magazine, they'd all see it. And if you put it on the website, half would already be there. And, but I think that might be something I'd really like to get the word out more to the American market.
Oh, good. I will be happy to do that. Mm-hmm.
That would be a huge honor. That would raise the bar of Orthotown single-handedly. That would just be an amazing.
Okay, sure, I bet. Mm-hmm. Thank you again.
Thank you, and hopefully next time I see you, it'll be in Taipei.
Okay, enjoy the rest of your night. Thank you.
Okay, thank you very much. Bye-bye.